a transfusion of packed red blood cells. Wow, this is a loaded question. So we would then need to look at each one of these four choices and say, are there any risks? And what are the risks for this patient? To say which of these four patients has the most risk factors. The most risk factors. You know, let's start with the youngest one first. So we've got D, the 19-year-old. Now, certainly being 19, we would make an assumption that's pretty low risk, right, for having a PE from a DVT and the complications of causing a DVT. But this 19-year-old is in sickle cell crisis. Now, is sickle cell crisis a risk factor? Well, actually it is. It is. Remember, patients with sickle cell disease are anemic. It's sickle cell anemia. And when a sickler is in crisis, they are more likely to clot. And this patient, this 19-year-old, is also currently receiving packed red blood cells, which will make the blood volume a little thicker, and that also could increase the likelihood of clotting. So there are some risk factors, age not being one of them for that patient. Now, patient in C is 22 years old. Well, that's younger than older. Little risk. Is a surgery, which increased risk. Is a trauma patient, increased risk. And is on birth control pills. Do birth control pills have anything to do with the risk for clotting? Absolutely, absolutely. Because female hormones, and I won't go into the detail as to how that all works, because it's not even part of the hematology section of the blueprint. But the female hormones actually affect some things as to how we clot, and that is and cause hypercoagulability, which is why if someone is considering going on birth control pills, or at the other end of the age span, hormone replacement therapy, if that woman has ever had blood clots, or is a smoker typically, the prescriber will say you're not a good candidate to go on female hormones because you are more likely to have a clot. So you might say then, well, how come women who are pregnant aren't hypercoagulable? You know, in the third trimester of pregnancy, you are hypercoagulable. But the other thing that happens in that third trimester is you have increased your circulating volume by about 50%. And that then is dilutional, which is why they don't clot. But the person who hasn't increased their circulating volume, like the woman on birth control pills, is hypercoagulable.